evening, Professor. My name is Kevin Santiago. I prefer going by Alexis. My career of choice is Doctor of Physical Therapy. So why I chose physical therapy? There is three superficial reasons and one deeper meaning. The three reasons being job security, financial stability, and the title of Doctor of Physical Therapy. So job security, in accordance to some research that I read that I actually pointed to in one of my papers, it indicated that there was going to be a growth in need for physical therapists. And then financial stability, as a kid, was a foreign concept to me. Retirement was a foreign concept to me. Foreign concept to me. Um, but with time, getting to know more people, and then as well as adapting to the U.S. System as an immigrant child, I want to be at the age of like 65, 60, 55, and not have to work anymore. Um, and then for the title, it's always been a joke within me and my friends, or my friends and I, sorry, that I'm going to use the title of Doctor of Physical Therapy at the dinner table whenever applicable. And then for the deeper meaning, is going to be to help the underserved communities as well as Spanish speaking individuals due to a um, cultural connection being there. In my experience working in the PACE programs as well as the behavioral health field at the home at the recuperative care slash unhoused facility, as well as my volunteer work, I found there to be a huge need for people, for physical therapists who really really care for them. I'm a strong believer in that exercise is good medicine, and there are plenty of ways that I can think of right now that I could help these individuals. So the following slides are going to be part just associations. The first and foremost being the American Physical Therapy Association, which I believe is the more known one. Um, so it's got a different variety of dues, depending on whether you're PT or PT student, you will pay less and more. For students, for example, they'll pay $80 and for the subsection that they want to get their information from for geriatrics or sports, that'll vary. And then that'll also change for PTs. The American Academy of Orthopedic Manual Physical Therapists, they also have a $65 to $180 a year fee. And then it'll also depend on just the kind of member that they are. The American Academy of Orthopedic Manual Physical Therapists, um, that was founded in 1991, and it's an organization dedicated to just improve the care using research as well as clinical excellence, and then they push that through the education aspect of it. So people, have the opportunity to attend mentorships, um, and discuss these physical therapy techniques because we are a very evidence-based practice field. And so a lot of these associations really do push that with the access to articles and research and so on and so forth. The American Physical Therapy Association, it was founded in 1921, and like I mentioned before, it helps push educational resources, articles, journals, and so on and so forth. The Academy of Pediatric Physical Therapy, this pediatrics is going to be for children. In order to be a part of this organization, it's almost like a sub-organization, you must first be an APTA member. And it's going to be $75 a year. For the Academy of Pediatric Physical Therapy, it was actually founded in 1973, and it follows almost the same type of rules in which it pushes science-based evidence resources towards its members so that they can better um, push their practice and better educate patients and better treat their patients to ensure that the best quality of care is available to each member or to each patient, sorry. Educational requirements. So I chose two different schools. Firstly, it's going to be St. Augustine. It's a university here in San Marcos, private university, and then a public university, which is San Diego State University. For San Diego State, for St. Augustine, You will be completing a bachelor's degree, and that will be used to apply for PT school as well as other prerequisites that would have been met with a C or higher. Um, the GRE is required, and that was one of the things that was clarified for me because prior to this, I wasn't sure if it was required or not, unless you have a master's degree at 3.6. And you will also, it is recommended that you do also apply with some clinical hours. That way, it makes the resume a lot stronger and makes you a stronger candidate. Excuse me. And then the pricing for the school will be $129,000. That's going to be the tuition plus other fees. For San Diego State, it is a public school, so it will be cheaper. However, the trade-off is that it will be more difficult to get into. It somewhat has the same requirements. The GRE is a requirement. The applicant must have a 3.0 or higher, and then all prerequisites must have been met with a C or higher, and the bachelor's degree is needed to get into this program. Um, there is also a requirement in the sense of there needs to be um, they want you to have different observation hours, whether it's like pediatrics and outpatient, inpatient, outpatient, acute, outpatient, or so on and so forth. I think this is something that could be used for both St. Augustine and San Diego State University, um, just because you want to be able to make your resume always stand out above the others and show that you've been really invested into this field. And then for the pricing for this school will be $91,000, which is significantly, so about $40 to $50,000 cheaper than the St. Augustine. But again, much harder to get into. The must-haves in order to be a doctor of physical therapy, you must earn your doctorate degree from a CAPTE accredited university, such as the schools that I mentioned earlier. You need to pass the NPTE, which is a entry-level competence test to ensure that they have the most qualified individuals licensed for to have the ability to practice. As well as they must also obtain state licenses. That's just to know that everyone is in compliance with the law um, and ethics, as well as pass the NPTE and submit your transcripts as well as proof of graduation. And then from my understanding, the CA the not CAPTA, the NPTE is this extremely difficult test. I have a lot of friends who are in the field, and they have all, there's a ton of them that pass it. There's a ton of them that have also not passed it in the first try. So it's a very, very difficult test to take. So now I'm going to be talking about some certifications that may benefit you as a physical therapist. One of them being the strength and conditioning specialist. This will allow you to work with a different type of demographic, more athletes, powerlifters, soccer players, so on and so forth. This can actually contribute to your knowledge as a physical therapist and help you tackle problems in a different way. It helps anyone who's in the training field, healthcare professionals, as well as education institutions. It'll help me better understand how to train and treat athletes to opposed to like a a patient who's on a wheelchair that isn't an athlete, like a 95-year-old patient that's on a wheelchair. Another certification, this is actually a certification that one of my friends has. He is a TMJ PT, so he has a certification, and I've been able to assist with some of the translations and some of the testings, just observing. And for that, it's two classes for $750, and it includes evaluations and treatments for TMJ disorders. Things that I'm working on. Currently, I am the need for some pediatric service hours that'll help me build up my resume. I actually need inpatient or acute rehab hours. I have a ton of outpatient hours working in the field for nearly 5 years. I'm pretty sure I already covered my bases on that end. However, I now need to work in a hospital setting or a pediatric hospital setting. Different demographics also will uh, widen up my scope of practice or my demographics. More knowledge will help me or or more knowledge or more experiences will allow me to become a physical therapist one day. Um, Actually, just as of 2 or 3 days ago, I recently just got hired at Tri-City. They are opening a new outpatient orthopedic clinic. Uh, and this place, in which I actually used the resume I made in this class for that position. Um, and the goal is that because they're still in the building process, that I will be getting some crossover hours. So my goal is to, yes, while I'm working in this outpatient clinic, that I will be able to cross over to the hospital setting pretty often in order for me to just rack up my hours. So I'm pretty excited about that. And why I believe I'm the best candidate for a physical therapist? Well, due to my nearly 5 years of working as a PT aide, I bring skills such as being bilingual, leading a team of aides in a really fast-paced environments in which we were seeing anywhere from 15 to 20 patients a day, as well as being able to provide the highest quality of care to my ability and encouraging my colleagues and teammates to also provide the highest quality of care. Because although, yes, it is a high-paced environment and maybe the time we might get is not as much as we would want to, we still have to ensure that the quality of care is there. And I do believe that I'm a strong candidate for that and that I am able to provide that quality of care, meanwhile being very time efficient. And that's something that's very difficult to find. My behavioral health, stock referring, and retail management experiences highlight my ability to deal with multi-personality demographics, um, anywhere from cognitive disabilities to mental health differences. I have been almost exposed to just about everything, whether it is, deep depression, substance abuse, Alzheimer's, dementia, just about anything. And I believe that I've been able to manage everything exceptionally well. And I think that will only be um, shown in my work as a physical therapist, no matter what facility or what place I'm in. I'm sure that I can provide the top quality of care that is needed. And this is important just when you're trying to build rapport, because one thing is having the patient in due to an injury and that they need to be there. Another thing is being able to maintain them and keep them there, right? So I can have a really, really, really good relationship with a patient, and that'll perhaps encourage them to trust me and for them to do their exercises at home. In comparison, that if they don't talk to me, I don't get to know them, they don't trust me. So why are they going to want to do the exercises? Especially for a lot of people, exercising is already something that's very difficult to do. Nevertheless, if they're already having issues with an injury, um, it might only make it even more difficult to want to do those exercises. So building really strong patient connections is super crucial, not only as a physical therapist, but I believe any healthcare professional. Thank you so much for listening, Professor, uh, and have a good rest of your night.